So when we're talking about parameters of traction, we have three things, is the way I like to think about it. We have force, time, and location. Force is measured in pounds of pull, and it's determined by many factors, including patient weight, type of table, and whether we're affecting cervical, lumbar, or spinal segments. This force can be static, which means you're just leaving it the same, or you can modify it. Is it constant or does it vary throughout the session? It can also vary throughout the treatments. So the first time maybe you're doing 15 pounds of pull, maybe the next treatment it goes well, maybe you're going up to 17 or 18 pounds of pull. Okay, you can increase or reduce the pull as needed according to patient response, as long as we're within the parameters that the PT and the doctor set and that you set, or that you confer with them on. Next, we have time. So with time, we have hold and relax times. And I like to think of ultrasound or E-stim where we had duty cycle, which is how long the current or the ultrasound production is on versus off. It's not always continuous. These hold relax times will be longer than we saw with electrical and ultrasound modalities. But it basically, how long are we pulling and how long are we resting for? Or is the pull continuous throughout the whole treatment? Then we have treatment time. Now, total duration is kind of independent of hold relax time. If you had a hold relax time of 4 minutes on, 1 minute off for a total of 5 minutes, and you did that 3 times, your total duration is 15 minutes. Or you could just be pulling for 15 minutes, providing traction for 15 minutes. And then frequency, of course, is how many times a week we're doing this. PT will usually set those parameters, or the doctor or the surgeon, and you will provide this as much as you can. But let's say your frequency is 3 times a week, and the patient doesn't come in on their Wednesday treatment. Well, maybe now you're only getting 2. So the frequency is it's technically just how many times you're going to do it a week, or how many times a day if you're having multiple traction treatments inside of one day for maybe like long extended therapy sessions or highly compromised patients that need a lot of this. Okay. And then we have location, which is, of course, where we are applying this. Are we applying it to the cervical, thoracic, or lumbar spines? Are we using the correct halters? And what position are we putting them in? We use the positioning of the lower extremities to modify spinal alignment and focus force production on the tissues that we want to produce force in.